Angioplasty is a medical procedure used to widen narrowed or obstructed blood vessels, primarily arteries. It is commonly performed to restore blood flow to the heart, coronary angioplasty, or to other parts of the body such as the legs, peripheral angioplasty, or the brain, carotid angioplasty. Causes: narrowing or blockage of blood vessels, typically due to atherosclerosis, a condition where fatty deposits called plaques build up inside the arteries, reducing blood flow. Other causes may include arterial dissections, blood clots, or arterial spasm. Symptoms of narrowed or blocked arteries can vary depending on the location and severity of the blockage. Common symptoms may include chest pain or discomfort, angina in the case of coronary artery disease, shortness of breath, pain, cramping, or weakness in the legs or arms, particularly during physical activity, intermittent claudication in peripheral artery disease, stroke or transient ischemic attack in carotid artery disease. Procedure. Preparation. The patient is typically given medication to relax and may receive local anesthesia at the site where the catheter will be inserted, often the groin or wrist. Insertion of catheter. A thin, flexible tube called a catheter is inserted into the narrowed artery under guidance from imaging techniques such as fluoroscopy or angiography. Guide wire placement. A guide wire is threaded through the catheter to the site of the blockage. Balloon inflation. A balloon-tipped catheter is positioned at the narrowed or blocked area. The balloon is inflated, compressing the plaque and widening the artery to restore blood flow. Stent placement. If necessary in some cases, a small mesh tube called a stent may be inserted into the artery to help keep it open. Stents are often used to prevent the artery from re-narrowing restenosis after angioplasty. Post-procedure. After the angioplasty is completed, the catheter and guide wire are removed, and pressure is applied to the insertion site to prevent bleeding. The patient may be monitored for a period before being discharged. Recovery. Recovery time after angioplasty is usually short, and most patients can resume normal activities within a few days. Medications to prevent blood clots and reduce the risk of restenosis may be prescribed. Angioplasty is generally considered a safe and effective procedure for improving blood flow in narrowed or blocked arteries, although complications such as bleeding, blood vessel damage, or allergic reactions to contrast dye may occur in some cases. It is often recommended as a less invasive alternative to surgical procedures such as bypass surgery.